Hello, Professor Gaz and students. This is Lena, and I am unable to take down my mask due to COVID regulations. So I will try to keep up my mask and talk as much as I can. The topic that I have selected is exercise physiology and adult cerebral palsy. And why did I select this particular topic? When it comes to cerebral palsy, a lot of research is done in field like when there are babies or they are at a young age in fields of pediatric physical therapy, example like neurodevelopmental therapy and sensory integration. But as an exercise physiologist, and especially when strength training is concerned, we don't find much material. But I was surprised to know that there was a research that had been going on in this field, and exercise physiologists have been working with special population as their personal trainers, and especially the fitness franchises like DPI, Adaptive Fitness, and Special Strong. These are the two companies who are specifically doing working in this field, and they are doing incredible work and job as respect to special populations, especially adult cerebral palsy. So for this final symposium with this topic, I have selected the article which is functional anaerobic and strength training in young adults with cerebral palsy, and this is from official Journal of American College and Sports Medicine, and the research was done by Gillette and Boyd and Barker, and they did a study to investigate the efficacy of 12-week functional anaerobic and strength training program on neuromuscular properties and functional capacity in young adults with spastic type of cerebral palsy. And for this study, they chose 17 young adults, 9 males and 8 females. It was a randomized control trial, and the study was for 12 weeks. And in this 12 weeks, the intervention group, which consisted of 8, and there was a waitlist control group which consisted of 9. So the intervention group, they did 3 sessions per week for 12 weeks of high intensity anaerobic and progressive resistance training exercises for their lower limbs. So the adult CP patients were trained for 12 weeks, 3 times a week, totaling of 36 sessions. And the session was divided into 2 parts. The first part was a progressive resistance training, and the second part was functional anaerobic exercises. Now for progressive resistance training component, like 5 lower limb resistance exercise stations were placed, which were like seated bent knee calf raise, leg press, seated straight knee calf raise, seated tibialis anterior raise, and standing calf raise. And for resistance training program, they had like multiple sets of 6 to 12 repetitions. And now we'll talk about the functional anaerobic training component, which consisted of 2 to 3 functional anaerobic exercises per session completed at maximum intensity that were adapted from a functional training study in children with CP related to everyday activities like stair climbing, bending, changing direction, and skipping over obstacles. Now the number of anaerobic exercises per session, repetitions were like around 1 or 2, and there was more like rest period involved. So researchers tried to measure the pre and post training plantar flexors and tibialis anterior muscle volumes, composition, and passive and active plantar flexion muscle properties and functional capacity outcomes. So this is what they tried to measure, and what they found was that plantar flexion and tibialis anterior muscle volume of impaired limbs, like in this intervention group, were greater in training group or intervention group than the control group. And the second thing, absolute or normalized maximum isometric plantar flexion strength was greater in training group than control group, and a peak anaerobic power, functional strength, agility, and walking distance were greater in intervention group as compared to control group at 12 weeks. So the results from the following results, it can be inferred, and in addition to the clinical perspective, functional strength and a measure of functional capacity improved after the training. So not just the strength, but functional capacity also improved, which provides a strong evidence for inclusion of functional anaerobic exercises in with progressive resistance training exercises for strength training of adult cerebral palsy patients.